Good afternoon. I'm Commander Anna Kahn, Associate Director for Communication with the Division of Environmental Health Science and Practice in the National Center for Environmental Health at the Centers for Disease Control and Prevention. I'd like to welcome you to today's Nexus webinar, Healthy Gardening, Tips for Preventing Lead Poisoning. There will be a presentation and a Q&A session with panelists. All participants joining us today are in listen-only mode. Closed captions are available for this webinar. Next slide, please. Today's Nexus webinar will be available to view on demand a few days after this webinar. You can find the video recording of today's webinar at the CDC Nexus webpage at cdc.gov/NCH/DEHSP/EHNexus, or you can scan the QR code. Next slide, please. You may submit questions at any time during today's presentation. To ask a question using Zoom, click the Q&A button at the bottom of your screen, then type your question in the Q&A box. Please note that we often get more questions than we can answer during a live session. If you're a member of the media, please contact CDC Media Relations at media@cdc.gov or at 404-639-3286. Next slide, please. The findings and conclusions in this report are those of the authors and do not necessarily represent the official position of the Centers for Disease Control and Prevention. Next slide, please. And now I'd like to welcome our presenters for today's Nexus webinar. We're pleased to have with us two presenters from the Agency for Toxic Substances and Disease Registry, also known as ATSDR, and one presenter from CDC. Our first presenter is Dr. Dawn Fowler, Chief of the Community Engagement Science and Intervention Section in the Office of Capacity Development and Applied Prevention Science at ATSDR. Our second presenter is Ms. Leanne Bing, an environmental health scientist with the Office of Community Health and Hazard Assessment at ATSDR. And our third presenter is Dr. Perry Ruckert, the team lead for the Program Development, Communications, and Evaluation team at CDC's Lead Poisoning Prevention and Surveillance Branch. And now I'd like to turn it over to Dr. Fowler. Dr. Fowler, the floor is yours.
Thank you. Good afternoon, everyone. As Anna indicated, I am the Chief of the Community Engagement Science and Intervention Section, CSIS is the acronym, in ATSDR's Office of Capacity Development and Applied Prevention Science. I'd like to take a few moments at the start of today's webinar to share an overview and high-level information about ATSDR's soilSHOP program, our development plans in that regard, and our upcoming plans to commemorate Earth Day, which is scheduled during the month of April. Next slide, please. ATSDR's Soil Screening, Health, Outreach, and Partnership, hence the acronym soilSHOP. soilSHOP events provide community members with free lead screening of soil gathered from their gardens or their outdoor play areas, for example. Our soilSHOP program contributes to the goals of the Federal Action Plan to reduce childhood lead exposures and their associated health impacts. The soilSHOP program is an important piece of the overall federal blueprint for reducing lead exposure in the nation. ATSDR regions and partners have hosted soilSHOP events in all of the 10 public health regions across 31 states. These community events are designed to raise awareness and to protect communities from the hazards of lead and other heavy metals in soil with a strong focus on health education. Next slide, please. Public health has a growing challenge to prevent lead exposure where residents garden and where children play. The popular effort of urban and community gardening continues to increase across the country, but not everyone knows that their soil can be contaminated with lead. And from a perspective of health disparities and environmental justice needs, children who live in urban environments and areas that have pre-existing lead-based industries around are especially at risk for exposure to lead-contaminated soil. Lead exposure in children can result from soil contamination and can cause irreversible and lifelong health effects. Even low levels of lead in blood have been shown to affect children's IQ and their ability to pay attention and their academic achievement. Although children are more susceptible to lead exposure, adults are not immune. Long-term or high levels of exposure in adults can also lead to high blood pressure or kidney damage. That's why ATSDR developed the Soil Screening Health and Outreach Partnership Program in order to help communities plan events where people can get their soil screened and learn how to prevent harmful lead exposures. And we want to do this through existing partnerships and improving our partnerships through our state health departments, where ATSDR has provides partners with resources to build their capacity to assess and respond to site-specific issues involving exposure to hazardous substances. And we do that through our Apple Tree, NOFO, and the funded recipients in the state health departments. Also through our PASU program, which is the Pediatric Environmental Health Specialty Units. And that's where we have, we're working to improve the sharing of information with health professionals and families and schools and childcare centers about pediatric lead exposure. And certainly other federal, state, local, and tribal agencies, including Protection Agency, USDA, and other county and community orgs. We also would like to focus on developing our community engagement practice, determining what best practice is, what are the kinds of tools and guidance that we need to develop and share with our partners in order to not only engage them around hazardous exposure, but soilSHOP in particular. So our ATSDR regional office and our state partners, we've hosted over 92 soilSHOP events across the country, and this is across 31 states. And our plan is to expand the reach and impact of our soilSHOP events through improved community engagement to impact environmental justice communities. Here we also have the link for our tools and resources in case viewers and partners would like to plan their own soilSHOP. This link has the soilSHOP planning document and guidance for viewers and partners to be able to access. Next slide, please. So Earth Day will be celebrated around the world, around the country during the month of April. The exact date is April 22nd. Earth Day is the brainchild of Senator Gaylord Nelson of Wisconsin. Years ago, he was a staunch environmentalist who hoped to provide unity to grassroots environmental work and to increase ecological awareness. The goal of Earth Day is to inspire the world to take action to conserve the planet, its natural resources, address environmental issues such as climate change, and promote sustainability. This year's theme is Invest in Our Planet, And the focus is to engage institutions and organizations, businesses, and citizens to take collective action toward protecting the planet. So ATSDR's public health regions across the country will be helping to host and implement soilSHOP events across the country during the month of April, and testing soil for free. soilSHOP events on Earth Day serve as opportunities for us to draw attention to environmental health impact, such as lead exposure, and the efforts being carried out across ATSDR as an organization. These events also help to highlight important programs, efforts, and partners working to prevent environmental health exposures. So we're very excited about Earth Day and our soilSHOP events that will be implemented across the month of April to commemorate Earth Day. Thank you. At this time, I'll turn it over to our ATSDR soilSHOP subject matter expert, Leanne Bean.
Ms. Bing, you may be on mute. Please stand by. I think we're having technical difficulties.
Can you hear me now?
Yes, ma'am.
Okay, perfect. So I switched to my phone and had technical difficulties there. All right, thank you very much, Don. It's a pleasure to be here. I'm Leanne Bing. I'm an environmental health scientist in the Region 4 office of the Office of Community Health and Hazard Assessment at ATSDR. And I'll talk to you about holding your own soilSHOP, the Soil Screening, Health, Outreach, and Partnership. Next slide. So what is a soilSHOP? As Don went over it so nicely. soilSHOP stands for Soil Screening, Health Outreach, and Partnership. It's a community awareness event designed to raise awareness about and protect people from the hazards of lead and other heavy metals with a strong focus on health education. Next slide. Next slide. Why conduct a soilSHOP? Lead and other heavy metals are common soil contaminants in urban and formerly industrialized areas. Heavy metals like lead continue to be an environmental health risk, especially for children, and there's no safe blood level. And there's a growing trend of urban and community gardening poses new health education challenges. There's a lot of advantages to the community to hold a soilSHOP. It provides health education on the hazards of lead exposure and how they reduce exposure to lead, and supports safe community-based gardening by sharing the best gardening practices. Next slide. How does the soilSHOP work? From the planning process all the way through the actual event, communities, partners, and local and state health departments work together to provide outreach, soil screening, and health education. The soilSHOP participants bring in the soil samples from their yards, their community gardens, or play areas to be screened with an XRF right there on site, and then received one-on-one tailored health education depending on their sample registration information, the soil used, and the soil sample readings. This is an opportunity for us to share the local lead prevention resources and services like blood lead screening. Next slide. Some key roles in soilSHOPs are planning and preparation teams, the login and registration staff, the soil screeners, and the people who take the data, and the health educators. Next slide. As you begin planning your soilSHOP event, it's a good idea to partner with a community-based organization or a federal, state, or local agency that serves the audience you wish to reach. A good community partner will have extensive experience working with this audience. Your community partner can help you organize the event, spread the word to prospective attendees, and provide support during the event. Partners also provide resources to support the event, such as staff, soil screening equipment, community contacts. They can share the responsibilities to offer other unique services to the community, in addition to the free soil screening and health education. Typical partners that we work with are local and state health departments, faith-based organizations, community centers, community gardening groups, agricultural extension offices, the pediatric environmental health specialty units, university programs, and other federal partners such as ATSDR, EPA, USDA, or just a few. At our 2019 Atlanta Science Festival SoilSHOP, our partners were Emory University, ATSDR, CDC, EPA, and Georgia Department of Health. Next slide. In planning and preparation phase, you and your partners will identify the resources for the event, such as the XRF for the soil screening, staffing, and other resources needed. Choose the location, the time, and the date. Will it be part of a larger event or a small standalone event? Choose additional activities. Example of partner activities were blood pressure checks, blood lead screening, how to build a raised bed garden, bee demos. We had cooking demos at some bands, Roomba dancing, vegetables from the local community gardening, and develop materials and messages to include signage, registration, and soil screening results, and health education specific to your community. Pictured is a flyer created by the Navajo Town Site, CDC, and the Red Lake chapter and the Navajo Nation EPA. ATSDR's How to Collect a Soil Sample was adapted to relate to the Navajo community. And there's a link to a video on how to collect a soil sample for a SoilSHOP that people can watch before they bring their soil samples in. Next slide. The SoilSHOP is now started. The residents will come and they go to the login and the registration table with their soil samples in clear zippered bags. The staff collect the information for each participant and complete the login form. Some of the login form questions are: where was the sample taken? Was it collected in the garden area or the play area, or just generally in the yard? How old is the resident? How close was the soil sample taken to the building or the street? What is the nearest cross street? And the health educator uses this information in the one-on-one health education portion. The staff assign a sample number to each soil sample, but addresses and other personal identifiers are not collected. Staff label all the associated forms in soil sample bags, and the staff provides participants with a sample number so they can collect their sample results once they're available. Next slide. In soil screening, why do we use an XRF and what is an XRF? XRF stands for X-ray fluorescence, and it's used as a handheld instrument that can measure the concentration of an element such as lead in a soil sample. The XRF technology uses either sealed radioactive sources or more likely the X-ray tubes to expose samples to X-rays. Why do we use an XRF at SoilSHOPs? By using the XRF, the SoilSHOPs can provide rapid screening analysis of lead and other heavy metals in the soil, which is followed by targeted one-on-one health education. The XRF equipment is powerful, cost-effective, and provides a rapid method of analyzing the soil samples. We can usually screen the soil within as little as 30 seconds, and it produces reliable results suitable for the SoilSHOP goals. Pictured is in blue XRF. Slide. At SoilSHOP events, we ask residents to bring the soil samples in clear bags. The clear plastic resealable bags work best, because then we can screen the soil directly through the bag. We check the soil sample for bag tears and large debris, such as rocks or twigs, and the soil should be dry. If damp, we have to leave it in the sun to dry, and if it's very wet, we're usually not able to screen it during the SoilSHOP. We place the sample on a dry, flat surface. We place the XRF directly on the sample. We screen 2 places on each side of the bag and then average the results. This is following EPA's guidance on soil screening. The staff document the soil screening results in a logbook, in a registration form, and on the sample results card. Everything is then passed to the health educator for the health education. Next slide. In the SoilSHOP after screening, the health educator reviews the soil sample results in the registration sheet, because remember the registration sheet shows where the sample was taken and the age of home. Those are all very useful information to have as part of the health education process. And then they provide participants with their results and conduct one-on-one consultation. Health education is the key to the community level primary prevention SoilSHOP event. It empowers the community members to understand the value of safe gardening and safe play areas. Health education also helps community members develop motivation to use lead poisoning prevention and methods. The goals include health education such as determine and target the neighborhoods at the highest risk for lead contamination, inform, educate, and empower individuals and communities to take preventive actions to avoid lead exposure in soil, mobilize community partnerships that identify and address environmental health problems, collaborate with local health agencies or departments, organizations, and other partners to promote the SoilSHOP as a prevention strategy for environmental health, provide community-based agencies and organizations with the necessary tools to link their communities to appropriate lead poisoning prevention and resources. Some health communication promotion promotes the awareness of soil lead poisoning, encourage communities to take actions to prevent lead poisoning when gardening or playing in soil outdoors, promote the importance of soil lead screening, and promote the use of lead safe practices when gardening or playing outdoors. And some health outreach is conducting the community health outreach efforts to ensure that lead and SoilSHOP information provided at community locations, promote and coordinate community education to increase the awareness of dangers of lead poisoning and create the awareness of safe gardening concepts, educate parents on how to make their homes safe and prevent lead poisoning in their children, and provide primary lead prevention education and outreach to community gardeners. Most children poisoned. One of our biggest health messages is that all children should get blood lead tested if they're under 6 years of age. And this is for people who bring in soil or people who sometimes forget to bring in soil. That most children are poisoned by lead that do not look or act sick. The best way to know if your child has lead poisoning is to have their blood lead tested. And we talk a little bit about all Medicaid enrolled children should be tested for lead at ages 12 and 24 months. Children not enrolled in Medicaid should be tested if they're at risk for lead poisoning, such as living in an area with lead in soil or lead paint. In the Atlanta area in the metro Atlanta area is all considered the at-risk area. And call your health care providers or clinic today to get your child tested for lead poisoning. Next slide. Now I'm going to go over some of our health messages that we would give to the families as they come to the SoilSHOP events. Whether the residents bring in a soil soup or not, it's important that they're all here for the health messages. Here are some steps that people can take to lower the amount of lead that gets into their body. Do not let children play in dirt that's contaminated with lead. Have children play on grass or in areas covered with lead-free mulch, wood chips, or sand. Keep children from playing in the bare dirt. Cover the bare dirt with grass, bushes, or 4 to 6 inches of wood chips, mulch, soil, or sand. Protect your family from lead-based paint in the yard. The homes built before 1978 might still have lead-based paint in the walls and the trim. As the paint ages, it can peel and chip away and become part of the dust and soil. And keep your family, especially young children, away from the areas outside your home where those old paint might be peeling or chipping, such as old porches, fences, or the sides of the houses. Do not try to remove the lead paint yourself unless you've been trained to follow lead-safe work practices. You can hire a lead specialist to follow the lead-safe work practices. Keep your children's hands and toys clean. Wash children's hands, toys, pacifiers, and dishes frequently. Help children keep their hands and toys away from their mouths, especially when they're playing outside in the soil. Check for recalls on toys that might have been contaminated with lead. And take other steps to reduce lead exposure, such as removing your shoes and wiping your feet on the washable mats before entering your home. Wash your pets regularly. And when eating outdoors, try to eat in areas where there's no bare dirt. Next slide. Eating. There you go. Eating healthy foods can now slow down how the body takes in lead and help prevent lead poisoning. This is another very important message we always give at the soilSHOPs. Lead poisoning can cause learning, hearing, and behavioral problems and can harm your child's brain. Some of the health effects can last a lifetime, and lead exposure to particularly harmful for children younger than 6 years of age because of their rapidly developing brain and frequent hand-to-mouth behavior. Some things that people can do to prevent exposure to lead is ensure that you and your family eat regularly vitamin C rich foods, strawberries, kiwi, oranges, tomatoes, green peppers, broccoli. Eat calcium rich foods like milk, yogurt, cheese, green leafy vegetables like spinach and kale, beans, lentils, sardines, salmon, iron rich foods like cereals, high in iron and seeds, dried fruits such as raisins and prunes, spinach, and other lean red meats. And routinely feed your child these healthy meals, because if you feed your child 3 healthy meals a day and healthy snacks, children with empty stomachs may absorb more lead. And other ways to reduce exposure to lead is washing your hands before preparing and eating food, washing fruits and vegetables well and discard the outer leaves of leafy vegetables and peel root vegetables such as carrots. Limited studies suggest that avoiding high-fat foods such as French fries, hot dogs, potato chips might help your body absorb less lead. So you could bake or boil food instead of frying, and use only clean cold water for drinking, cooking, and making baby formula, because hot water from the faucet is more likely to contain lead. If you run the cold water 30 to 60 seconds before using it to flush out the impurities that might have gotten into water from the plumbing materials. And do not store your food in glazed pottery from other countries that the glaze may contain lead. Next slide. And then we always talk about some good gardening practices that people can do when we're at the soilSHOP, like lead exposure from eating fruits or vegetables grown in the soil that contains lead can be a major health risk, especially to children. The lead in the dirt and the dust can coat the surface of the fruits or the vegetables that could be taken up into fruits and vegetables themselves. You can protect your health and learn how to lower your risk for lead exposure with these kind of tips. Like you wash your hands immediately after gardening, give preference to fruits growing fruiting plants like tomatoes, corn, if you need to plant plants directly in the soil. Maintain a soil pH of 6.5 to 7 to reduce plant uptake of lead. Keep the soil moist and use barriers such as mulch on and around your garden to reduce soil and dust migration from the bare soil. Add organic materials such as peat moss or manure to your soil. These bind with lead in the soil so the vegetables absorb less lead. And you can always use raised beds for gardening. Once you have your garden and once you clean your produce, to wash and scrub the fruits and the vegetables with a brush to remove bits of soil and dust. To peel or skin root crops such as carrots, potatoes, turnips, onions before eating them. And discard the outer leaves of leafy vegetables such as lettuce, cabbage, and Brussels sprouts. Next slide. In 2020, I'm going to talk about one of the soilSHOPs we held in our Region 4. Emory University Psychiatry Lab, the Historic Westside Gardens groups, ATSDR, our Region 4 office, Georgia Department of Public Health, and Adopt a Stream organized a soilSHOP event in Atlanta, Georgia. We had approximately 200 residents, including families with children, attended virtually because this is 2020. The residents were able to drop off samples at our partners' locations, and we had partners all over Atlanta, from Emory University to Georgia Environmental Protection Division, Atlanta Botanical Gardens, South-Based Institute, Historic Westside Gardens, Chattahoochee Riverkeeper, Gwinnett County Government, Caldy's Coffee, and Cobb County Watershed Stewardship. that's again emphasizing how many partners we need to hold the virtual SoilSHOP for free soil screening to anyone in Georgia. They registered on Dr. Sakawa's Emory University website. They watched the ATSDR video on how to collect a soil sample, and then they either mailed their soil sample directly to Dr. Sakawa's lab, or they dropped a soil sample at our partners' locations, and then EPA and Georgia Department of Public Health screened the soil for lead, and then Georgia Department of Health and the Emory University provided health education to the community members. This event demonstrated how the SoilSHOPs can safely provide outreach and education during a pandemic. Typically, after the samples are screened, health educators, as we talked about, meet face-to-face with each participant and go over the results and the best prevention practices. However, to ensure participant and staff safety, Georgia Department of Public Health and Emory University contacted the participants by either phone or email to explain their soil results, answer questions about best practices for gardening and outdoor play, and provide additional resources. Next slide, please. This is just a quick overview of some of our successes in Region 4, which is the 8 southeastern states. We screened over 400 soil samples. We've identified sites and areas with legacy lead contamination. In fact, one was later identified as a National Priorities List site, or Superfund. Provided lead health education at least 500 SoilSHOP attendees, provided lead health education in for 2,000 residents near toxic waste sites in Atlanta and Chattanooga, Tennessee, and in Jacksonville, Florida. Provided blood lead testing information. Established partnerships with local community groups, local clinics, federal, state, and local agencies, universities. Some of our impacts are that we increased awareness to hazards of lead in soil, increased the use of safe gardening and play area practices, and increased awareness of local resources available to assist with lead exposure and remediation. Next slide. Thank you for listening. I hope you will dig in and hold a SoilSHOP. Feel free to contact me if you have other questions, and now I'll pass it on to Dr. Perry Recker.
Thank you, Leanne. Okay, so good afternoon. Today I'd like to discuss CDC's childhood lead poisoning prevention efforts. Next slide. So CDC has been involved in lead poisoning prevention efforts for over 30 years, and our program seeks to eliminate childhood lead poisoning as a public health problem, and we're committed to decreasing blood lead levels in children and eliminating disparities in blood lead level by race, ethnicity, and socioeconomic status. Next slide. To reduce childhood lead poisoning, our program's activities focus on strengthening 4 core strategies. These include blood lead testing and reporting, surveillance of children's blood lead levels, targeted population-based interventions, and linkages of lead-exposed children to recommended services. Next slide. And we support lead poisoning prevention activities nationwide. Our program's activities focus on supporting state and local health departments in childhood lead poisoning prevention activities, educating key audiences, conducting research, and providing technical expertise to other agencies and partners. This map shows the states and local public health agencies that we currently fund. We fund 47 state health departments for testing, reporting, surveillance, and linkages to care, and 12 localities for targeted interventions, and 3 states for capacity building. And this is our most expansive funding package to date. Next slide. So children who've been exposed to lead often have no apparent symptoms. And if there's a concern, a blood lead test is the best way to determine if a child has been exposed to lead. The amount of lead in blood is referred to as the blood lead level, which is measured in micrograms of lead per deciliter of blood. And blood lead levels in children can be easily determined by a blood test. During a blood test, a small amount of blood is taken from the finger, heel, or arm and tested for lead. two types of blood collections may be used. A finger prick or heel prick, commonly known as the capillary collection, is usually the first step to determine if a child has lead in their blood. And a capillary collection that shows a blood lead level at or above CDC's blood lead reference value is usually followed by a second collection to confirm. And a venous blood draw is the confirmatory test taken from a child's vein. And this type of collection can take a few days to receive results and is the best type of blood collection to confirm the levels seen in the initial capillary collection. Next slide. So children enrolled in Medicaid are required to get tested for lead at ages 12 and 24 months, or between ages 24 and 72 months if there's no record of them being tested. And for children not enrolled in Medicaid, CDC currently recommends focusing efforts on children at higher risk and following state and local requirements. However, in 1991, CDC recommended universal testing. And since 1997, CDC began recommending the targeted testing efforts for children at higher risk for lead based on sociodemographic and environmental risk factors. But currently, some states do implement universal testing for all children. Next slide. So CDC provides recommended actions to take based on blood lead levels. And these recommendations are listed on the CDC Childhood Lead Poisoning Prevention website as a resource for clinicians. And based on the child's blood lead level, a clinician may provide education on the sources of lead and ways to prevent exposure, monitor the child's growth and development, assess the child's symptoms, refer the family for lead inspection and removal services, and initiate medical treatment. So for blood lead levels at or above 3.5 micrograms per deciliter, that's the current blood lead reference value, CDC recommends arranging for an environmental investigation of the home to identify potential sources of lead as required. And during an environmental investigation, professionals check the child's environment for possible causes of lead exposure and recommend ways to prevent further lead exposure. However, blood lead levels less than 5 micrograms per deciliter may not trigger a Department of Housing and Urban Development, or HUD, environmental investigation when the housing is covered by HUD's lead safe housing rule. Additionally, environmental investigations for blood lead levels that are between 3.5 and 19 micrograms per deciliter vary based on jurisdictional requirements and available resources. Ultimately, I feel a sneeze coming. Okay, I guess it passed. Ultimately, the provider is responsible for deciding how to treat children with lead in their blood in consideration of state and local requirements. Next slide. CDC is working to increase rates of blood lead testing among U.S. children. And according to an HHS Office of the Inspector General report, 30% of children enrolled in Medicaid did not get tested at required intervals. There tended to be a drop-off in testing between ages 12 and 24 months, and over 1 in 5 of those enrolled did not get tested by age 3 years. CMS requires lead testing at 12 and 24 months for Medicaid recipients. This disparity, along with recent device shortages and the pandemic, have caused a decline in blood lead testing. And the lead program is undertaking several initiatives that we believe will have a positive impact on testing rates. And these include lowering the blood lead reference value. That was in October 2021. So following this, CDC collaborated with environmental health professionals at the Council of State and Territorial Epidemiologists, or CSTE, to update their position statement for childhood lead poisoning. And they provided uniform criteria for reporting cases of selected diseases to CDC's National Notifiable Disease Surveillance System, or NNDSS, and I'll discuss that more here in a minute. We're pursuing improvements in our surveillance system and methods to improve data quality and reportability, and these include a soon-to-be implemented feed of blood lead surveillance data to the Environmental Health Tracking Portal and trading to funded programs on continuous improvement of surveillance and reporting processes. Plans to establish new online training modules, which will be available on demand. They'll cover a variety of topics and are presented from over 20 subject matter experts in the field of lead poisoning prevention. We created case vignettes based on real-world inquiries received by CDC to highlight lesser-known ways that children are exposed to lead and show that all children can be exposed. We expanded outreach to healthcare providers by running ads in Medscape and on other platforms for healthcare providers that encourage providers to test children at risk. We engaged with pediatric environmental health specialty units, or PACUs, poison control centers, nursing practitioners, and others. We're planning to release the Lead Exposure Risk Index, or LERI, later this year, which is a tool to help identify and map community risk for lead exposure. Next slide, please. So CDC has been involved in defining the criteria to interpret blood lead levels in children since the 1970s. And over time, scientific evidence emerged showing that even low levels of lead cause negative health impacts. Additionally, no safe blood lead level has been identified. So in 2012, CDC established a population-based blood lead reference value, and it was based on the 97.5th percentile of the blood lead distribution in U.S. children ages 1 to 5 years from the National Health and Nutrition Examination Survey data. That's the NHANES data. And at that time in 2012, it was set at 5 micrograms per deciliter. That was based on NHANES data from the 2007 to 2010 cycles. And it was updated, as I mentioned, to 3.5 micrograms per deciliter. And that was based on NHANES data from 2015 to 2018. I just want to point out that the blood lead reference value is not a health-based standard or a toxicity threshold, but updating the reference value allows CDC, federal partners, and health departments to focus resources on children with higher levels of lead in their blood compared to most children. It also supports CDC and the administration's commitment to health equity and addressing environmental justice. And there are significant disparities in exposure and health outcomes across racial, ethnic, and socioeconomic status. I want to note that CDC no longer uses the term elevated blood lead level. And in July 2022, CSTE changed the name of the condition under surveillance from elevated blood lead level to lead in blood and updated the criteria for reporting and the case definition and case classifications. Also on our website, we have a fact sheet that describes what terminology we recommend instead. So next slide, please. So lead-contaminated soil continues to be a hazardous source of lead exposure for young children in this country. And soil can be contaminated with lead from exterior lead-based paint that flakes off into the surrounding soil near homes and buildings built before 1978. And it also can be in the soil from past leaded gasoline and industrial sources. And this slide shows a quote, and Carla's son was diagnosed with a blood lead level of 11 micrograms per deciliter. And for context, CDC recommends follow-up actions for children with a blood lead level above 3.5 micrograms per deciliter. Carla could not pinpoint her son's source of lead exposure, and it turned out repeated exposures to small levels of lead in her yard soil were enough to poison her son. Next slide. I apologize. This is her quote. According to Carla, she said, "The house was recently painted and there were no obvious lead hazards. There were some small bare soil areas in which my son would play, but nothing too overwhelming. I had my soil tested and the samples came back less than 400 parts per million, the standard for a child's outdoor play area. But a child like my son, who eats dirt and puts everything in his mouth, was exposed repeatedly to low levels of lead, which can build up in his body. And as you saw in the previous slide, he had a blood level of 11. Next slide. So for more information, please visit our website. It's listed here on the slide. And on our website, you can find a directory of our funded state and local programs, data and statistics, various publications and guidance documents, frequently asked questions, laboratory guidance, and communication materials. Next slide, please. So I just want to end by thanking all of our colleagues and everyone involved in the fight against childhood lead poisoning prevention. As everyone knows, these things take a village. So thanks. I'll turn it back over to you, Anna.
Okay, thank you. All right, so thank you, Dr. Fowler, Ms. Bing, and Dr. Record for providing our audience with this important and timely information. We'll now go into the Q&A session. Please remember to ask a question using Zoom. Click on the Q&A button at the bottom of your screen, then type in your question. Please note that we often receive more questions during the webinar than we're able to answer due to time restraints. And I can tell you we have a lot of questions. So let's get started on those questions. So my first question is for Leanne. Ms. Bing, do soilSHOPs test for multiple contaminants or just for lead?
As the soilSHOPs, our primary focus is on lead, but our XRF actually shows other contaminants, other heavy metals that are in the soil. And so if we see, typically with lead, we see arsenic is a very common other metal that we see in the soil. But we focus on lead because lead is extremely common.
Okay, thank you, Ms. Bing. Our second question, Leanne, is also for you. The soil sampling cartoon that you presented during your presentation, is it available? It differs from the one that's on ATSDR's website and contains more information. We're planning a soilSHOP and would like to use this cartoon if possible.
The one that I showed was actually by our partners, created it using the cartoon from our website. They used the black and white version and then they colored it to make it look more like their community.
Okay.
But I'd have to reach out to the partners to see if they could share that one, but you can see it from my slide.
Okay. Thank you, Ms. Bing. And the
And
next
feel free to contact me for more information.
Okay, wonderful. I'll include our email so that they can reach directly out to you. Thank you. And our next question, Ms. Bing, is also for you. And this is it. Let's see. I am the president of the Puerto Rico chapter of the American Academy of Pediatrics. How can we organize a soilSHOP in Puerto Rico?
They could reach out to the ATSDR Region 2 office to help them with organizing the soilSHOP in Puerto Rico. The Region 2 office covers Puerto Rico, Virgin Islands, as well as New York and New Jersey.
Okay.
And again, they can contact me for that information. Okay.
Thank you. And I'll include at the end of this presentation, I'll include our Nexus email so that those of you that have these additional questions, you're able to reach out directly to Ms. Bing, okay? The next question, Ms. Bing, is what model XRF does the soilSHOP use? Is it the standard XRF like and I'm hoping I'm saying this right, VIKEN, PB200I, lead paint analyzer, or is it specifically designed for soil?
Thank you for that question. The XRFs are specifically designed for soil. I think we have an Olympus Vanta XRF, but anyone that is designed for soil, specifically for soil, and to screen for heavy metals.
Okay, thank you. The next question, Ms. Bing, is will an XRF pointed right at the soil in a yard or garden get an accurate reading?
Using EPA's guidance on, yes, pointing directly at the soil will give an accurate reading. In fact, EPA has guidance on using XRF for doing their soil assessments, which is much more than our screen our screening is similar to like a blood pressure reading. We just are looking for information and not evaluating the entire problem. Where we screen for soil, we only take a couple samples from the yard. With EPA doing assessment for the yard, they would take multiple samples at different locations and different depths. But yes, the soil XRFs are used for soil screening as well as for soil assessments.
Thank you, Ms. Bing. So consult with EPA guidance regarding the XRF. Ms. Bing, the next question is, how common is lead contamination in soil in non-urban areas?
That's a good question. It depends on the area. If people were storing batteries that when they had lead in them in that area, it's very easy to have lead in the soil in that area. If there were in some, sorry, my mind just went blank. If you had like old tanks being stored in that area, or like on my grandfather's farm, they had the old barrels that had lead on them, there'd easily be lead in that soil in that area. Or if they were next to an industrial facility that had lead, or they had smelter waste that they used to fill in little areas in the agriculture areas, the yard, you could easily have lead. So it's a definite possibility.
Okay, thank you. And Ms. Bing, this question is, I've read putting sand or sandbox on top of the soil to protect children from lead exposure. Is there other methods or preventative measures of children, of telling children how to stop playing in the soil or a way around the soil? So using a sandbox as opposed to just letting children play in dirt.
If there's lead in the soil, you know, we have different ways, any ways you can prevent children coming directly in contact with the soil, and that could be either have grass that's covering the soil, or mulch, or sand, or anything that is keeping the kids from touching directly to the soil and then putting their fingers in the mouth. That's how kids get the lead from the soil.
Okay, thank you. This next question, Ms. Bing, is soilSHOP seems to be a great outreach activity, but I'm curious about whether community members in these events were upset when they found that they had lead in their soil. The health messages we give put pressure on families to handle the situation individually, such as getting children tested, eating well, and to cover bare dirt. Does soilSHOP offer resources to help the families and provide guidance?
Thank you. That's a good question. Personally, at ATSDR, we do not have the resources, but that's where we partner with our local health departments and our state health departments, who at times do have resources, or even community groups may have resources to help. In one of the soilSHOPs we attended, they had a community group that was helping people do the blood lead testing that they were looking for their children, and they helped them set it up by phone, and it was a nonprofit that worked with them through that entire process. And that's definitely why partners are so important.
Thank you, Ms. Bing. Dr. Ruckert, this next question is for you. Is lead poisoning reversible?
So while the effects of lead exposure may be permanent, if caught early, there are things that parents and caregivers can do to prevent further exposure and damage to their children's health. And our website has more information in the lead poisoning prevention subpage.
Thank you, Dr. Ruckert. And here's another question for you, Dr. Ruckert. How can lead levels in the body be reduced?
So when someone's exposed to lead, the body stores it in blood and bones, and the amount of lead in the blood decreases gradually after exposure to lead stops, and as the body releases some of it through urine, sweat, and feces. For bone lead, though, it can take decades for it to decrease. So if a child has very high levels of lead in their blood, healthcare providers may recommend chelation therapy to remove some of the lead from the blood. And a balanced diet with foods that provide calcium, iron, and vitamin C may help keep lead out from the body.
Thank you. Thank you very much. And on that note, that is all the time we have for questions today. So I just want to thank our presenters for their time. Thank you so much for joining us for today's webinar. And at this time, that concludes our webinar.